Welcome back to the WHHI Daily News. With us now is Dr. Debi Lynes, along with Wilhelmina. And today we're talking about pet therapy. And why I love this topic is we have Shelby, and Shelby's a Cavalier King Charles Spaniel. And without Shelby, with my husband in particular, he would be lost. Mm-hmm. It gives him so much companionship because I'm here at the station, I'm directing a play, whatever.
Exactly.
So pet therapy, why is it so critical for
so many people?
Well,
it's so funny because I think pet therapy has gotten a bum rap recently, but I want to talk a little bit about what pet therapy really is and what it does.
Okay.
Really what it does is add connection. Yes. That's all it is. It's connecting to someone outside of yourself. Right. For people who may have depression, anxiety, feel lonely and isolated, gives you a reason to get up in the morning. Right. It gives you a reason to be and do things. And I thought it might be interesting to talk a little bit about the difference between a service animal and an emotional support animal.
Okay, so what is the difference?
Well, this is more of an emotional support animal. Okay. And so what he's being trained to do is to work with people who have anxiety. And his sole purpose, and the way he does that is through his scent, is to pick up if someone is feeling nervous. My assumption is right now today he can sense that I'm excited, I like this, but we're in hyper gear, so there might be a little bit of anxiety. So he's trained at that moment to be calm.
Get close to you.
Get close to, that's right, just to get close to me and just be there. And it's really interesting. Now, a service dog on the flip side of that, is a dog that would be working with someone who has diabetes, can't see, seizure disorder. And I think a lot of people wonder, how does that even work? Well, what's really interesting about people who have seizure disorder, and that's a real easy one to explain, is before someone has anxiety, before they have a seizure, they oftentimes emit hormones, and they emit this sense that you and I can't pick up, but that the dog may be able to pick up. Pardon me, or the service animal. And at that moment that dog senses it, he is taught to behave in a certain or specific way. And that's why they're so valuable. And that goes back to PTSD for veterans. They can sense the anxiety, they know how to respond and react to it, and it's really an amazing thing.
Well, let's go back to the pet therapy for like people that are in the hospital, when they can have like the pets, come in to someone who has been in the hospital a long time, or even I know at some of the prisons, they had a pet therapy program for some of the inmates, providing that, as you said earlier, the connection, the support, giving them a reason to get up in the morning, and having some responsibility gives them purpose.
Yes, meaning, and I think sometimes plain old-fashioned distraction. I'm in so much pain, I feel gross, I feel yucky. All I've seen is this hospital room or wherever, and in comes this fuzzy little, giant little, whatever it is. And for a few moments, your mind is less on yourself, less on your discomfort, and more on the little thing that is around you. And so the power of that is pretty amazing. Wilhelmina is 3 months old, and I've had her now 5 days.
5 days.
And so she's been in pretty serious boot camp. And what that looks like is pretty well contained. When she's out, she has their expectations of what she shouldn't do in a loving way.
Is she a rescue?
She is, I would like to call her a rescue. She is a giveaway dog. So, yes, but she's obviously
so sweet.
Calm. She just closed her eyes and is asleep right now.
Is she trained? I mean,
I am. So does that answer your question? I mean, I am definitely trained.
Right. Well, she's beautiful and just so cuddly.
Exactly.
It makes you feel good and just, warm and fuzzy.
And with all of the rescues out there, and whether it's a kitten, a puppy, just some kind of an animal. We know horse therapy, equine therapy, Pat the Gala is unbeatable. And from a therapeutic standpoint, it doesn't get better.
Right, very good. Thank you, Dr. Debi Lynes, and we'll be right back with more news and Wilhelmina.